Now let's move over to our final section. In this section, we will talk about epilepsy. We will talk about the implications of disease and pregnancy, management of epilepsy, and then we will talk about some other causes of seizures in pregnancy. First, epilepsy. Epilepsy affects approximately 1% of obstetric population, or about 1% of female who are pregnant. So epilepsy is 1%. Then implication of pregnancy on disease, we have effect is of epilepsy is variable. Seizure frequency is unchanged. So seizure frequency of epilepsy is not associated with pregnancy. Frequency is unchanged. So if the patient before pregnancy has frequency of suppose roughly 3 attacks in a month, they will stay as 3 attacks of epilepsy or seizures in a month. So it's unchanged. Increased seizures due to non-compliance with medication and sleep deprivation. But the frequency can increase if the patients are not using the medication for epilepsy, and if they are not sleeping well, that can change the frequency. But otherwise, in normal conditions, the frequency is unchanged or unaffected. Risk of sudden unexplained death in epilepsy. There is risk of unexplained sudden death in epilepsy. Implications of disease on pregnancy. High risk of congenital abnormalities. Epilepsy is associated with increased congenital abnormalities, mainly due to hypoxia or anoxia associated with epileptic attacks. High perinatal loss is also common. Probability of having a child with epilepsy. So if the mother has epilepsy, there is chance that the baby will also have epilepsy. Medications used, we use sodium valproate, have greatest risk and should be avoided. Most commonly used drug during for epilepsy, sodium valproate, have a high risk during pregnancy. It has effect on the fetus. It can lead to congenital abnormalities, intrauterine growth restriction, and neurodevelopmental effect. So sodium valproate should not be used during pregnancy. Carbamazepine and lamotrigine are better, safe anti-epileptic drugs during the pregnancy. So sodium valproate is not recommended. Instead of that, carbamazepine and lamotrigine is used. Management, preconceptual counseling is important. Review medications. Again, any women who has epilepsy and they want to conceive, make sure they should talk to their physician that what will be the consequences of epilepsy on the baby and on the mother during pregnancy. So counseling is important. They should be aware of all the complications associated with epilepsy, and also the physician should review the medications they are using, and they should be informed that these medications are not safe and they should switch on to another different medications. Avoid seizures in pregnancy. Maternal and fetal screening is important during the pregnancy to find out if they have any associated complications or not. Vitamin K use. Antenatal advice is important. Now let's talk about some other causes of seizures in pregnancy. Besides epilepsy, there are some other conditions that can cause seizures in pregnancy. And these are eclampsia. Eclampsia is a condition which when preeclampsia, it can progress to eclampsia, in which the pregnant women usually they present with seizures attack, and it is condition in which there is high blood pressure, protein, urea, and seizures attack, and there is known as toxemia of pregnancy. The amniotic fluid gets very, very low as a result of eclampsia. So one is eclampsia. Another condition is encephalitis or meningitis, in which there is inflammation of meninges that covers the brain and spinal cord, or inflammation of the brain. Then we have some space occupying lesions like different tumors, growths can cause seizures during pregnancy. Cerebral vascular accidents, CVAs, which can lead to hemorrhage and seizures during pregnancy. Cerebral malaria or toxoplasmosis. Thrombotic thrombocytopenic purpura. Drug and alcohol withdrawal, so some substance abuses, drugs which are used by the pregnant women, or if they use too much alcohol, withdraw from the drug and alcohol can cause seizures. Toxic overdose, and then metabolic abnormalities. So all these can lead to seizures during pregnancy, and then seizures are associated with so many different complications on the outcome of the pregnancy. So it should be avoided during the pregnancy. So all these causes that can lead to seizures should be diagnosed and treated in the early phase. So that was all about the epilepsy and some other causes of seizures during pregnancy. Thank you for watching sqadia.com.